I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to talk to us about COVID-19 today and give us an update on what has been happening with COVID-19 in our area, in the state, in the nation, and in the world. And also today, she's going to talk to us a little bit about a question that came in from one of our viewers. One of the questions that has been asked several times, and not just by this viewer, is, how will we know when restrictions can start to lift and when the is in sight for the pandemic? Bonny, can you give us a little bit of information about that related to epidemiology?
Sure. I actually read a lot about this past week. I mean, I have my views on how things, what I would like it to look like, but how do you actually define in? And it became very obvious that people don't have a hard and fast rule, but they do seem to break it into both social, like socially ending it, and medically ending it. And socially, I'm not going to talk about, but that's essentially when everyone says, I give up, it's done. And then they let it spread, and the cost of that in lives is really high. So we're going to avoid that for this discussion and stick with the medical. And this includes two types where you can eliminate the disease, and by elimination, we mean you reduce it to a really low number. Or you can eradicate it, like people have talked about smallpox, eradication of that. That's where you're completely wiping it out. And with the SARS-CoV-2 virus, the one that causes COVID, we do know that it breaks down in air in about 2 hours, and it breaks down on surfaces in just a few days. But it could hang around in someone's respiratory tract for quite a while, even up to a month. So if you want to eradicate the SARS-CoV-2 virus, it would require everyone in the entire world sort of hunkering down and not going anywhere or doing anything for a couple of months. And then it would be eradicated. Well, that's not going to happen. So really what we want to do is we want to reduce it to a really low number or eliminate it. And the two main indicators that I think could be used to do this, and these are different than what the thresholds are that the city's looking at. And before I get into this, I'll just explain that the thresholds are tracking the outbreak early on when cases are going up. That R value that we look at, that's measuring the rate of sort of the increase in cases. What we're going to talk about here are the level of community spread. So how prevalent is the virus out in the community, and also immunity among the population. And with the original SARS-CoV-2 virus, they were estimating that roughly 75% of the population may need to be immune to this virus in order to get that herd immunity. Well, there's this new B.1.17 virus that it's the virus that has been identified in the UK that caused such a very rapid increase in cases there in the last month. It is now, there's some cases in the United States, including Minnesota and Wyoming. The CDC thinks that this particular variant of this virus will be the predominant one sometime in March. Well, because this virus, based on things that they know about it, it looks like you're going to have to require about 80% of the population to be immune to it. And the reason for that is it is much more easily transmitted. So it spreads from person to person much easier than the original SARS-CoV-2 virus. They don't know right now whether there's a higher death rate from this virus than the original one. There are reports this past week out of the UK suggesting that that might in fact be true, but the CDC has requested the data, and they would like to look at it first before actually saying that. Because if it is an increase, it's not a real big increase. But if it's more easily transmitted, that means more people are going to get it, more people will end up hospitalized, and there will be increased deaths. But it's not, the case fatality rate shouldn't be that different. Because the B17 variant is much more easily transmitted, we will need a higher percentage of the population vaccinated to achieve that herd immunity, as I just mentioned, and we need to be more vigilant with public health recommendations. Some of the recommendations that are coming out right now to address this variant is that perhaps people will need to wear 2 masks, that a cloth mask may not be adequate, that you may need to wear something like an N95 or this KF94, which is similar to the 95, and then a cloth mask over that. But I'm not sure people really know that yet, but that is out there at the moment. But the purpose for all these public health recommendations is we really need to buy time to get people vaccinated. So going back to those indicators, the first one I mentioned was level of community spread, and we ideally would like to see that at minimal. Well, ideally we'd like to see it at none, but we'll assume that none isn't going to be possible, so we would like to see it at minimal. And these definitions are based on the number of new cases per week and taking into account population size. So minimal spread would be less than 10 cases per 100,000 population. Moderate is 10 to 99 cases per 100,000 population. And substantial is 100 cases or more per 100,000 population. And this is actually how the Department of Health and the CDC both define community spread, or the level of community spread. And so what does that translate in terms of numbers for both South Dakota and Brookings County? So this is the number of new cases per week at each of those levels. So to be in minimal spread, South Dakota would have to have less than 87 new cases per week, so between 1 and 86. Brookings County would have to get down to 1 to 3 new cases per week. Moderate spread, 87 to 863 for the state, whereas for Brookings County, it would be somewhere between 4 and 33 new cases per week. And substantial spread for the state is 864 or more cases per week, whereas for Brookings County, it's 34 or more per week. And I think I've said that a lot of times in the weekly updates. We just need to get below, 35, because that would get us out of substantial. 34, 35. For the last week, for as of yesterday, in the previous week, South Dakota had 1,604 new cases in a 1-week period. So you can see that that's double what the cutoff is for substantial. Same with Brookings County. We had 67 new cases last week. It's much better than what was happening in November, but it's still twice the amount of cases that would get us down below substantial spread. And you see, if our goal is really minimal, it's even a lot more reduction in the number of cases. And I have on these graphs that the city posts every day, I do have the cutoff that shows where the substantial to moderate. So if we get below this, we'll be in moderate or minimal. But this yellow line is the 7-day running average. This is done on a per day basis rather than a per week basis like the definition is. And that's explained in the footnote of the graph. But you can see we're a ways away from that thing, but we're definitely heading in the right direction. Over here, when we had the outbreaks, we were much higher, than substantial, the cutoff for substantial. And the state is the same way, it's still above substantial spread, but it is getting closer and heading in the right direction. So what about level of immunity? Well, you can get immunity either through being infected with the virus or vaccination. And immunity from infection, we don't really know for sure like what level of immunity you have or for how long you have it. And therefore the CDC is recommending that everyone be vaccinated, even people that have already had COVID-19. With the new variant, as I've mentioned several times, it's estimated that 80% will need to be immune for that herd immunity to kick in. Right now in South Dakota, 6.4% of the population's been vaccinated. These are the vaccination rates for the counties with the 10 most populated cities. I didn't start tracking these other counties until mid-November or mid-January, sorry. Whereas I did start tracking Brookings back here in December. So these counties were vaccinating at the time. I just didn't keep track of the data. So 6.4% as of yesterday, 4.7% for Brookings County. Where of the 10 counties, we have the lowest percent of the population that is immunized. But we need to get this closer to that 80%. So what do individuals and communities need to do? We need to continue to practice the public health recommendations, wearing a mask, socially distancing and avoiding crowds, practicing good hand hygiene, and then also because we're so far north and it's winter, be aware of ventilation issues if you're in rooms or buildings that you don't know the people that are in there. And also get vaccinated when possible. I mean, the website for Brookings Health System, you can sign up, you can get on a waiting list now for that. If you don't go to a clinic in Brookings, if you go to one at either Sanford or Avera, those clinics will be administering the vaccine. Otherwise, you need to go to the Brookings Health System, and that's on the DOH website. So we need to continue to practice these. We need that spread to be minimal, and we need a high percent of the population vaccinated. And there still are a lot of unknowns. One of the things is we don't know whether people that have been vaccinated but may be infected and are asymptomatic are able to transmit the virus. So that's one of the reasons they're asking people who get vaccinated to continue wearing face masks, just so that they're sure that they're not going to be spreading. If they happen to have gotten infected and don't know about it, they don't want it spreading to other people. We also don't really know how long the natural immunity or immunity from the vaccine lasts. And we do need to protect our friends, family, and neighbors. And I have a slide on positives. So we're definitely heading in the right direction. We're just not there yet. And it is really amazing how rapidly scientists are learning new things about this virus and being able, therefore, to come up with ways to prevent the infection. So that's my answer to the email question.
And it sounds like, we've learned so much this year about, the virus. It's obviously a new virus, and, at the beginning we didn't know anything, and now we know quite a bit more. But with the new variants, that kind of changes it again, because we don't fully know what it is about the variants that make it different.
Right, and there's a lot of different variants. It's not just this B117 from the UK. There's a couple other ones. There's a Brazilian one, South African one, and viruses mutate. I mean, that's known. Their DNA gets, jumbled up, especially when it's replicating so fast. So that actually is another reason to really go for getting people vaccinated quickly, because you don't want to end up sort of taking a long time and having the virus mutate into something that is not, that the vaccine's not good for, and now you have to go to a whole new vaccine. You know, right now, these variants that are out there are thought to be, you know, the vaccine is thought to be pretty effective against them. So we need to get rid of that virus or really reduce the numbers before it mutates into something that is harder to prevent.
And as that information comes out about those different variants and what they're learning about them, and as well as how long, you know, the vaccine will last and how long people will be immune based on natural immunity from getting the virus, is the CDC probably the best place to kind of look for that information coming out?
Definitely. They are, you know, the public health organization for the United States. I mean, or agency. So yes, the CDC is a great place. They have a lot of resources on their website. The Department of Health also has a lot of links on the CDC. So if you go to the DOH website, you can always find a lot of those CDC links as well.
That's good to know, because I know that more information is coming out every day, and people at home are probably wondering, you know, where can they follow along to find that information on their own?
Yeah, there's quite a bit on this new variant on the CDC website, actually.
Well, good to know. Thank you, Bonnie.
You're welcome.
So what's been going on with COVID-19 in our area and across the rest of the nation and the world?
Well, in our area, it is looking good, as you saw from some of those graphs earlier. Brookings still substantial spread, as we just went over. But this past week, there were 67 cases compared to 111 in the previous week. So you can see that there is this decline, and we're getting closer to that cutoff. So we just need to kind of stick with it. A total of 3,366 cases. Yesterday, we had 206 active cases. There have been 116 people hospitalized, or actually Brookings County residents that have been hospitalized. We had 2 new admissions this past week and 4 in the previous week. Deaths, 33 total deaths among Brookings County residents, 1 this week and 1 last week. Test positivity, among people tested, is 28%, and among tests done is 9%. That 9% is looking really good too. I think it's been a really, really long time that it was above 10%. So we're kind of trying, it looks like it might be getting down there. 4.7% of Brookings residents have been vaccinated. Last Sunday, it was 3.8. So hopefully that will speed up as more vaccines become available. As far as the state, again, substantial spread, but you can see there were roughly 1,600 cases this past week compared to over 2,000 in the previous week. Yesterday, there were about 4,000 active cases. There were 6,193 people hospitalized, 130 admissions this week compared to 159 in the previous week. As of yesterday, there were 162 people currently hospitalized, and 36 of them were in the ICU. 1,705 deaths, 49 this week compared to 71 in the previous week. So that's dropped as well, which is really good. And again, the test positivity, if you look at it among tests done, that's down to 8%. So that's also heading in the right direction. 6.4% of South Dakotans vaccinated as of yesterday compared to 5.2 the previous Sunday. The US, the cases are also going down, and this is one of the things the CDC is worried about with the variant, is that it's going to cause it to come back, do something like this where it was going down and then come back up again. We've had Little over 25 million cases, 1.26 million this past week compared to 1.6 million in the previous week. The deaths were still up there, you know, close to, I mean, pretty really high amounts, over 3,000 deaths per day. There have been 427,000 total deaths, 22,000 roughly this past week, compared to 23, almost 24,000 in the previous week. Worldwide, we're going to be hitting that 100 million mark pretty soon. There have been 99.3 million cases. It's also going down a bit with 4.37 million this week compared to 4.87 million in the previous week. More than 2 million deaths worldwide, and there are running about 99,000 deaths this past week compared to 96,000 in the previous week. And then again, I'm just sticking this up here, this link. I did hear some things where people thought they may have been positive for COVID, and they did this mail, you know, do it in your home kit, and it took them 10 days to get the kit, which means that it's not very helpful if it keeps taking that long. So it's really not a bad idea. You can order them and keep them until you might need it. Might not be a bad idea for people to have one on hand in case they need it, so they can get the tested and get the results turned around quickly. So it's important to keep identifying cases and their contacts to keep this under control. So that's it for this week. Hope it just keeps going.
Well, thank you, Bonnie. It is great to have some positive news this week and see those declines across the board. It'll be interesting to see what happens with the variant and see if that changes or how that works out. So
Well, hopefully
the updates. And, you know, we'll just keep doing what we're doing, and everyone's doing a great job.
Yeah, they are. Keep it up.